Hi, I'm Lorna Jackson, clinical and spiritual hypnotherapist, and I just want to update everyone to the changes to my hypnotherapy business. After a 20-year career in hypnotherapy, working face to face with clients, I have now decided to semi-retire, which basically means I no longer see clients face to face. I've taken my business online. And because of this, I'm limiting the number of clients that I see per week for Zoom sessions. Now, I'm just wondering, have you done telehealth? Because most people today are familiar with telehealth sessions with their medical practitioner or their psychologist. And hypnotherapy is a therapy that works just as well online as in person. Because what matters most is your willingness to open up and to participate, and provided you can hear me and I can see you, then we have everything we need to conduct your online hypnotherapy program. In fact, hypnosis actually works better online, because most people don't know that when they are focused on a screen, either a phone or an iPad, when you're on social media or working on a computer or playing games, they automatically enter into a hypnotic state. And this is because your brainwaves slow down when you focus on a screen. Now, most people don't understand what hypnosis is, and they assume that they need to be face to face with a hypnotherapist for hypnosis to work properly. But this is absolutely not true. So let me explain this in a little more detail. I like to explain things so people understand. Now, the brain basically goes through 4 brainwave cycles or states. That's what we call them. Now, the sleep state is called delta and is not a hypnotic state. The beta state is the wide awake state or brainwave cycle, and this is not hypnosis either. Now, the 2 hypnotic brainwave cycles or states are called alpha and theta. Did you know that your brain slows down when you're in alpha? And this is when you are daydreaming, watching television, when you're on a computer or a screen, if you're at the movies, if you're reading, even drinking alcohol and smoking weed puts people into a lower brainwave cycle, which is hypnosis. You don't have to be physically relaxed to be in the alpha state, because hypnosis is not relaxation. It is a slower brainwave cycle or state. Now, the theta state of hypnosis is the deep state everyone goes into just as they're going to sleep. The body automatically relaxes, the mind relaxes, and then sleep happens, which is delta. So for some people who have sleep problems, they easily go into theta, but find it very difficult to switch off the mind, the monkey mind, thinking to go to sleep, which is delta. So the mind is not asleep when in hypnosis, and the person can still think, hear, move if they need to. The body only relaxes because the hypnotherapist gives the subconscious mind suggestions, directions to relax the body. So what most people don't know is that the subconscious mind is in charge of the body and follows the hypnotherapist's suggestions to relax, just as it follows the suggestions to stop smoking or make any changes that the client wants to make. Now, the subconscious mind is the part of the mind of the client where the hypnotherapist works. And when the client feels comfortable and safe, they're more likely to allow the hypnotherapist access to this part of the mind when in hypnosis. And this happens quicker and easier when the client is in their own environment at home, in their own bedroom perhaps, feeling safe and comfortable. Now, there are many benefits to having hypnotherapy online, and for people who have anxiety, just going out can be really stressful. Often they have agoraphobia, and online hypnotherapy eliminates this stress. And when the session is conducted in the comfort and privacy of your own home, and because you're at home, you'll feel calmer and more relaxed when you do your hypnotherapy session. And this increased relaxation is incredibly helpful and allows you to open up more freely and be more present in your session. Now, it is very easy to set up for an online session. The client can either sit in a comfortable chair, you can be upright like I am now, with a headrest. Now, you can lie on a bed, but propped up with pillows behind your back. And make sure that the camera is positioned so that you can be seen on the screen from the head to the waist. To be alone in the room, so you're not going to be disturbed by children, pets, people, or even a ringing phone. And you need to have your device, your laptop or iPad or phone, sitting on a table is best, not to hold it, because as you enter into a hypnotic state, you drop the phone or the device from your hands. Now, wearing headphones with a mic is a really good idea for sound quality. So I can hear you well and you can also hear me. Now, the internet is really stable these days, so dropouts are very rare. But if this happens, it's easy just to reconnect, and I give all my clients instructions on how to go about that before we start a session. Now, many people have received a recommendation from friends or family to see me over the years. I get lots of referrals. Often people are living abroad or in a different state or territory, and it's just not practical to travel to see me. And others have children or jobs or other restraints and struggle to come and see me during my practice hours. So having online sessions is really beneficial. And I've been seeing people online for a long time, and advances in telecommunications and information technology makes the world more connected than ever before. And you can too benefit from online sessions. I can guide you through the process, even if you're not tech savvy, and you will feel totally comfortable with the process. I've facilitated past life and life between life regression sessions online. I've also done current life regressions very successfully, as well as assisted clients to stop unwanted habits like smoking, alcohol. In fact, any problem can be treated with my hypnotherapy online sessions, and often only one session is required. Now, some problems are complex, like trauma, post-traumatic stress disorder. Medical issues like chronic pain often need to have a few sessions to resolve them. So your first session will be around 90 minutes and will need to be paid in advance. And follow-up sessions are generally about an hour. So if you're considering having a hypnotherapy session with me online, just email me at hypnoresults@gmail.com. And if you have any further questions and you would like to ask me anything about the session, I'm happy to set up a complimentary online Zoom chat where we can connect to see if we're a good fit. And we can organize a time that's most suitable for your needs. Now, maybe you've already booked your appointment with me, and that's why you're watching this video, because I've sent it to you to watch. So I'm really looking forward to working with you very soon. So thanks for watching, and I look forward to seeing you.